PHIERS.org, a collaborative project, high impact and low cost, a systems approach to structural problems facing society today. Starting with our veterans in Southern Maryland, they're among the first to benefit from this solution. With simple enhancements, we can meet the needs of other populations too. Remember, you can have the best healthcare system in the world and even the best insurance plan, but without access and transportation, none of this matters.
Some of the biggest challenges we face today in healthcare aren't even big challenges. This is why Patriot Medical Transport has teamed up with PHIERS.org to help the people around us. It could be your neighbor or your mom or your aunt or your friend. And what happens is these people may not have adequate transportation just down the street to the pharmacy or to a doctor's visit. And what that causes is health problems. They end up going to the ER. They might get a prescription or two for their symptoms. They get released. They get told to follow up with their doctor. Well, then they get back home and they have no way to the pharmacy to get the prescription. They have no way to the doctors to do a follow-up. Their symptoms worsen, their condition worsens, and then they end up going back to the ER for yet another admission to try to solve these issues. So the hospital kind of becomes their doctor's office. It's happening in every community, every county, every state around us. And it's one of the biggest issues that we actually face these days. And that's why Patriot's very pleased to be joining forces with PHIERS.org to help them solve these problems. Another pilot that PHIERS.org and Patriot are teamed up to assist with is our veterans. 15, 20 years ago, you would refer to a veteran as a 75 or an 80-year-old male from World War II or the Vietnam War or something like that. But now we have younger people, 20s, 30s, 40s, 50s, that are just coming back from Iraq or just coming back from Afghanistan, and they've not only got amputations or other traumatic injuries, but also mental diseases and stuff now, such as PTSD.
Yeah, I've been an EMT with my local EMS department for the last 6 years, and within the last 2 years or so, I've seen an influx that we've had in the transports with the veterans or the elderly, and it's been the recurring patients that we've seen more and more often. Half of them either have mental issues like PTSD, whereas others are more physically handicapped. I think that we should have more available options for the veterans that have been serving our country to help protect our freedom.
And we couldn't agree more. That's exactly why PHIERS.org and Patriot Medical Transport Systems have come together with a new pilot that will connect veterans and families of wounded soldiers to the wraparound support services that they deserve and need. The best part is that with your support, we can be up and running by the end of the year. PHIERS provides health IT resource matching and referral services, while Patriot provides medical transport, care coordination, and dispatch services, and is creating a program to have paramedics help patients better comply with their self-care and discharge instructions, with a focus on using local resources that are already standing by to fill the unique needs of veterans and wounded soldiers and their families who've already given far more than they've received. By combining referrals with a secure health information service and cost-efficient technology, every patient that participates in our program can receive continuous care across settings, even when it's from a fragmented healthcare delivery system that's comprised of costly private doctors and competing hospital systems. In 3 simple steps, we can help veterans receive the care that addresses the needs of the whole person, by making it easy to share health status and summary reports quickly and securely. In this way, we'll function like an intelligent glue that delivers on our nation's goals for a national e-health exchange to make it easier to coordinate care across settings. This is in complete alignment with the ONC's goals for building an interoperable, private, and secure nationwide health information service while supporting the widespread, meaningful use of health information technology. What we have is a low-cost and secure way to expand access to coordinated care for any beneficiary of government-funded services. The best part is that we can accomplish all of this without increasing taxes, raising the deficit, or requiring any legislation. It's in this way that we can get our veterans access to near-term local resources that address the needs of the whole person while coordinating interventions and working together as part of a holistic and expanded care team. Regarding our ongoing pilot in Southern Maryland, there's a lot to be excited about. Patriot is starting its 7th year of support for the Maryland's Commitment to Veterans program, which began as a 6-month pilot. We've assisted countless veterans in receiving the behavioral and mental health support that they need, and we're in expansion mode. Working together, Maryland can be among the first states in the nation to provide wraparound support services for veterans and the families of wounded soldiers in a way that's self-sustaining, that leverages local resources to control costs and be responsive to the unique needs of our veterans and their families. We're seeking funds to tailor our program for each participating community. Evidence suggests that after the first year, it'll pay for itself through savings directly attributed to participation. We invite other regions to join us too. By helping veterans better comply with their self-care and discharge instructions, we'll decrease the likelihood of complications, ER visits, and readmissions in ways directly attributed to our program. In fact, together with our partners, we'll work together to coordinate care and share data across settings, as well as reinforce effective interventions, desired behaviors, and track and report on outcomes over time, believing that every patient enrolled in our program will get better coordinated care, resulting in better outcomes and less time and for lower costs than patients that are not enrolled in our program. In this way, we'll help the VA make the most of the $17 billion that have been set aside to provide veterans with access to privatized care. This is important because the private sector is still fragmented and competitive, despite billions that have been paid to achieve interoperability. And as we all know, fragmented care is more costly and of lower quality than what it is that we'd have if we worked as a team. For this reason, PHIERS.org is inviting organizations with a social mission to join us on this quest. What's in it for you? Tools, training, support, and technology to help you track outcomes and cost benefits over time, so you can be rewarded through grants and other benefits that are attributed to your participation. Saves will fund our ongoing operation and future expansion, which means that since the majority of veterans are seniors, this solution will also address the needs of beneficiaries of the VA as well as Medicare and Medicaid services and the ONC, which allows these organizations to get into alignment around a single structured project that has implications at the local, state, and national level for our most costly healthcare consumers, veterans, and poor seniors with multiple chronic diseases. This project combines trusted relationships and referral services with medical transportation and secure health IT, and can become an intelligent glue that makes it possible to coordinate care across settings in an affordable manner. For program and service providers that proudly support our veterans, we invite you to register for our upcoming pilots. Once you're enrolled, we'll send you invitations to our webinars, training, and planning sessions so that you too can learn how to make the most of this opportunity in your community. To learn more, visit us at PHIERS.org, the media section, or PatriotMedicalTransport.com. We look forward to working with you to make a positive difference in the lives of our veterans, our seniors, their caregivers, and anyone else who needs it, including our school-age kids and everyone in between. Safety net programs can be strengthened and expanded in an affordable and sustainable manner, and the time is right. So if you want to be part of the change that's so desperately needed, we hope you'll support this program. PHIERS.org. And happy holidays.